Good afternoon, everyone, and thank you so much to our wonderful staff for joining us today for our last staff teams live for the semester. And we have lots of updates for you, but we're going to try and be really crisp and to the point so that you have sufficient time to ask all your questions. So I'm Patty Prelock, as you know, your Provost and Senior Vice President, and want to thank you, as always, for the incredible work that you do. And we actually have sunshine today, which is great. Today, Gary is going to provide us with a campus update, and then I'm going to just give you a few academic updates that will be relevant to those of you who work in the units. Mary has some ideas and thoughts about some human resource pieces that will be important for you, and Tessa and Francis will help us with understanding some health and safety updates, and then we have some exciting news about fall reopening, and Gary will share that. And then we'll quickly move to questions so that we can answer the questions you have. So I think I'm going to just head it right over to our awesome Gary, who is my hero in keeping us healthy and safe through COVID with his entire team. So go right ahead, Gary.
So thank you very much, Patty, and it's great to be with everybody today. I wanted to give you kind of a general update on where we're at with the state of COVID on campus. And these are some really impressive numbers. Since February 1st through the 19th, we've done 185,362 tests on campus. That is pretty remarkable, what we've done over that time. We're on track to do over 430,000 tests on campus by the end of this semester. I have been so impressed with the dedication and the commitment on the part of our students to going and getting tested on a regular basis, and that has just been great to see them do this. I'm also pleased that the last couple of weeks we've started to see a steady decline in our cases. Last week we reported 11 on-campus cases and 22 off-campus cases. And last week we did over 18,000 tests alone in our Davis Center. We recently implemented a policy where students who are fully vaccinated, and we're seeing more of those, can exempt out of the twice weekly testing, but they're still required to test every 7 days. I think what's really great to see, and throughout all of this, has been the rate of the positivity on our campus has always been well below the state's average and certainly well below the Northeast and Vermont. And that has just been a wonderful reflection on our campus. I know everybody was concerned, and we all were, about the time in March and April when we saw an uptick in the number of cases on campus. And while we knew that was going to happen, I think it all took us by surprise, but I'm really pleased to see that those numbers have started to drop. I'm also pleased, and I know many of you are aware what the incidents up on North Beach almost 2 weeks ago, that we've continued to see no fallout from those. We've not seen an increase of cases, and that's particularly good news. Next slide. I know it was about 2 weeks ago when Governor Phil Scott announced his Vermont Forward plan. I don't know about for you, but it just felt great to hear those benchmarks and to look at that time frame where we can start to aim for that July 4th. And I don't know about you, but I'm planning one of the biggest 4th of July parties I think I've ever had to mark us at a new phase in Vermont Forward and also UVM Forward. It's been great to think about the steps we need to do, but we've got a lot to get to that point. And you can see that each of those steps are tied to a clear goal, and that is the rate of vaccinations in Vermont, particularly for all Vermonters, but then Vermonters 16 and plus. You can see that there's changes that we go through during that period of time. It's one thing important to note, and a lot of people ask questions about the disconnect of why are Vermont guidance and restrictions different than the universities. There are several sectors of business in Vermont, higher ed being one of them, where there are very specific guidelines and requirements for that industry that we have to follow. And then we have to take those guidelines and implement them on campus. So some of them are still more restrictive than what the states are. And we look at adjusting those as we go along. One of the key things that the state has allowed is more interaction around vaccinated individuals. And until recently, our age population on campus really hasn't even been able to get vaccinated. So next slide, excuse me. I really do believe that brighter days are ahead. And I think one of the main reasons, and you're going to hear me for the next, every chance you get to hear from me say, is get vaccinated, get vaccinated, get vaccinated. I am really pleased that beginning next Thursday, anyone 16 and older, whether they're residents or non-residents, are eligible to get vaccinated. I would encourage you, with the students that you work with and you come in contact with them, help them, encourage them, support them. The registration process is not hard. You can register now, even if you're not eligible vaccines until a particular date. But I really want to encourage you to get vaccinated, as well as to ask your help in getting our students to get vaccinated. Those that are residents of Vermont and those that are staying over the summer are eligible. And last weekend, they opened it up to 16 and older Vermonters, and it was pleasing to see the rate of pickup of that population. So I think we do have brighter days, but it's really going to be tied to that rate of vaccinations at this point. So thank you.
Thanks so much, Gary. And so I'm just going to give you a few academic highlights. Just some key dates to remember. As most of you may be aware, the last day of classes is May 11th. We do have a reading day on May 12th, and then the exam period is May 13th and 14th and 17th and 18th. The registrar's office has had the exam schedule posted since February, and just so you know, there are some classes that are having in-person exams, and so we've asked faculty and staff to remind students of that. As you know, we also have adjusted our commencement, but I'm so glad that we can have an in-person commencement. It will be on Thursday and Friday, May 20th and 21st. And the last faculty day on contract is May 28th. In terms of the fall, I know later Gary is going to give you some information about UVM Forward and our fall planning, but we anticipate fully in person next fall, with about 94% of our undergraduate courses are scheduled to be in person, and there will not be an at-home option. The graduate balance is likely to be a little different, reflecting the needs of the grad students. In terms of enrollment management, we're right in the middle of bringing in our next year's class, but at the same time, we have to take care of our current students. And Jay Jacobs, our Vice Provost for Enrollment Management, is leading a team, I believe, with several staff who've been engaged in this process to reach out to our current first-year students and plan some opportunities to welcome them back next year. We're finding that our first year students are the most vulnerable, so anything you can do to support them. You know, they had a really not great senior year in high school, and then their first year in college was not at all what they were expecting. So we want to make sure we bring them back. So any special messages you can give would be appreciated. And then the last piece, as you know, we're going through a reorganization and visioning for the future. There have been about 24 different forums, and I encourage you to participate in any way that you can. We really want staff input. So there is a feedback form that is downloaded weekly, and every single thing is read and given to the working group to look at. So I encourage you to give your feedback from a staff perspective. So thanks for just doing everything that you do to support the quality of education for our students. I really appreciate it. And now I'm going to turn it over to Mary, as she's going to give us some human resources updates. Mary?
Thanks, Patty. As always, I want to begin by expressing my gratitude to staff for their extraordinary efforts every day. It hasn't been simple or easy, and although I would hazard that we're all looking forward to putting this particular period behind us, it's not over, and we have to keep our guards up with masking, social distancing, and getting vaccinated. Yesterday actually was my daughter's 17th birthday, and I got her the best birthday present, and it was her first Pfizer shot. So we were pretty delighted about that. As we start planning for the future and next academic year, in addition to encouraging everybody to get vaccinated, I do want to reassure staff that the university will continue to offer telework and flexible working arrangements. What form that will take will vary and more details will follow. Various working committees continue with their efforts to memorialize the best of our telework practices learned over the last year. We're interested in hearing from individuals about what has worked and what hasn't for them as supervisors and as employees while living and working mostly from home. And one of the ways that you can share your knowledge and hopefully learn from others is by participating in our professional development and training sessions that are specific to working remotely. Although these sessions were developed as part of EDU, they will be offered again this summer and fall to allow for more employees to participate. We've all seen how important it is to consciously cultivate and maintain connections and to exercise strong communication skills while working and supervising in remote environments. And then lastly, I'd like to note that our employees, like so many others across the nation and the world, are feeling a range of emotions about physically returning to office spaces. So please, let's all keep this in mind and demonstrate patience and empathy whenever we can. For some of us, the thought of a resumption of quote unquote normal activities brings us joy. We can't wait to be back with our colleagues and face to face and engage in person and not through a camera and a screen. For others, the same thought makes us anxious. We're worried about how we're going to readjust to daily contact with multiple persons from, not our own households. So just remember that senior leadership, your supervisors and managers, everyone, we're all in this together. And we share the common purpose of making UVM the best institution it can possibly be. After all, employee satisfaction and wellness, they drive productivity. And when we have that, everyone wins. So thank you, Patty.
Thanks so much, Mary, and thanks for the positive notes and also the reminder that transition is going to be challenging for all of us, and being kind and supportive, we will get through it. I know we're resilient. So our next group, both Tessa Lucy and Francis Churchill, are here to talk about some health and safety updates, and I believe Tessa is up first.
All right, thank you, Patty. So the first thing that I want to talk to you about today relates to some of the different requirements, and Gary had touched on this earlier. At Health and Safety, we receive questions from employees who just aren't sure which guidance documents they're supposed to follow. We've heard reports of people not adhering to UVM specific requirements. So really the simple answer here is that employees should also always be following UVM requirements. They sometimes are going to match what the state has. Sometimes they're going to be a little bit more restrictive. As Gary mentioned earlier, the Vermont Forward Plan, it's aimed at getting us back to some level of normalcy by July 4th. Currently, though, the higher ed is not part of the universal guidance. Education has been carved out. So, we hope that higher ed will eventually also fall under universal guidance. But until that happens, we need to at least meet the baseline that's established in the higher ed specific guidance. And I want to remind folks that within the Vermont's higher ed guidance document, it does state that institutions are encouraged to exceed the baseline recommendations. So this means that they're very likely going to continue to be situations where the state sets a higher bar or has different rules for colleges and universities, and where UVM may even set a higher bar than that. So what's important is that you pay attention to the UVM strong messages. If it's something that's really important, we're going to send out a separate communication. It's also good for you to periodically check the guidance page that we have set up, and I'll share the link in the chat so everybody has that. A good example of one of these areas where UVM requirements are a little bit exceed what the state says is regarding out-of-state travel, which actually is a good segue into the next topic I want to talk about today, the daily health screening. Before I get into the specific example, though, I just want to remind folks that unless you are 100% remote, there is still a requirement that you fill out the daily health check-in form. If you're sometimes remote, sometimes in person, you still need to fill it out every day that you're scheduled to work, even on the days that you're not coming to campus. And then if you are 100% remote, but you're coming to campus for one reason or another, get a COVID test, pick up a file, etc., you still need to fill it out for that day. So the updates to the health check-in form itself, recently the state updated requirements around out-of-state travel. If you're fully vaccinated, you're not going to even see the travel or the quarantine questions. So that's one place that it's been updated. If you are not fully vaccinated and you answer no to the vaccine question, you'll also notice that all the county-specific drop downs are gone. Since you no longer need to quarantine, vaccinated or not, that part is gone. If you, where the state has changed is that if you're not fully vaccinated, you now need to get a COVID-19 PCR test within 3 days of your return to Vermont. So, for example, if I wasn't fully vaccinated and I'm going to visit my parents in Massachusetts, if I'm scheduled to return on Sunday, I'm going to need to get my test no later than Wednesday. And we've updated the instructions on the health screening to reflect those changes. So when you submit your form, it's important that you follow those new instructions. So getting to the example that I mentioned earlier, where UVM is a bit more restrictive, is that vaccinated or not, the state guidance says you no longer need to quarantine. Again, if you're not vaccinated, you need to get a test within 3 days. UVM also doesn't require that you quarantine, but partly because we have a high concentration of students who are not yet vaccinated, we are requiring that you not come to campus until you get that negative test result. So the state of Vermont has said you need the 3-day test, but you can pretty much go around about your normal business. Here at UVM, we're saying that you need to get that negative test result before returning to campus. Nothing's changed with the symptoms, but just as a reminder to folks, if you're not feeling well, if you're sick, even if you're vaccinated, even if you don't think it's related to COVID, unless it's related to a pre-existing condition or a known cause, the instructions are going to say that you need to be cleared by a healthcare provider before returning. That part hasn't changed. The other change is regarding the vaccine question itself. It used to be a yes/no response, but now it's a yes or no/prefer not to answer. So if you, for whatever reason, you don't want to provide your vaccine information, you have that option. But just to keep in mind that if you answer no or prefer not to answer for the purposes of coming to campus or coming to work, you're treated the same whether or not you're vaccinated or not. So if you prefer not to answer, if you're not going to give that information, then we have to assume that you're not vaccinated. Which then brings me to the third thing I want to talk about, vaccine impact and some of the other benefits that come along with being fully vaccinated. As I mentioned already, if you respond yes to the vaccine question, you're not even seeing the traveler contact questions. So one benefit is you don't have to quarantine. You don't have to get that 3-day test. If you're fully vaccinated, you have some additional allowances as far as multi-household gatherings. And as things progress and as Vermont, using the governor's words, opens the spigot a little bit more, if you're vaccinated, you'll be able to do more. As I mentioned earlier, or I think Gary mentioned it, the timelines in the state reopening plan is based on the number of Vermonters who get vaccinated. So getting vaccinated not only allows you to do more, it also allows the collective us to do more. And with that, I encourage you, if you haven't done so already, sign up and get that vaccine. And now I will hand it over to Francis, who's going to talk about some summer planning.
Thanks, Tessa. So after 3 mornings of waking up to snow, I get to talk about summer. Pretty fortunate that way. And as I'm going to talk about summer, I want to remind us we're not quite there yet. And as a Red Sox fan, I'm very cognizant of what can happen in the 9th inning. So until we get to summer, we really got to continue to follow the plans we have in place now. And as Tessa mentioned, that the state right now doesn't allow us to operate under different plans, and probably won't before the end of the semester. Other businesses will be able to open in under universal guidance. So instead of having specific operating plans, they'll just stay home when they're sick. They'll wear face coverings, 6-foot spaces in uncrowded places, practice hygiene, and adhere to travel guidance, which are the state's universal guidance. So until we get to that point, we are under our current plans. During the summer, we expect to transition to something, which could be the universal guidance, it could be something else. We are not expecting or asking departments to submit new operating plans for the summer. We are relying on the safety officers and supervisors and logistics officers who are currently identified in the plans to help implement any changes or pivot as we need to. So those folks have been meeting every Monday. We'll continue to have our every Monday morning meetings through the semester with the safety officers. During the summer, we'll continue to have the meetings. It may not be every week, but we'll continue to have those meetings so that we can communicate changes and pivots that might be needed. The other thing during the summers, we will have undergraduate and graduate students on campus, and they will continue to be expected to test. And so we have a registry process for those students. Students who are enrolled in a 4-credit program through Banner will be registered through that process with the testing center. Other students will need to be sponsored, and we'll have the details of that, I believe, next week on how that sponsor program will work. It's much simpler than it was over the winter break. So I promise you that. But it will be a way of just inputting students who need to be on campus so that their names will show up in the testing center. And like I said, we'll have details on that next week. And even though I don't like to wish time away, I am looking forward to the beginning of summer. So, Gary?
So thank you all very much. Next slide, please. So probably the most popular question I get right now is, will we be requiring vaccines for students? I want to respond to that. I'll talk also about for employees, for faculty and staff. We've not made a decision yet. And if you look at the Chronicle of Higher Education list on its site, the number of institutions that have published their decision, it's only about 50 or 60 institutions right now across the country of over 3,000 that have announced their decision to require vaccines. We are taking a deliberate process. We're consulting with our medical professionals, and we're looking at what are the key points that we need to make before we can make that final decision. And right now, there really are 2 variables that we need to take into account. Excuse me. First is that all 3 of the vaccines only have what's called emergency use authorization from the FDA. We would feel more confident, and we think that will occur probably in the next 6 weeks, if the FDA gives full approval and authorization for the various vaccines. And second is we need to make sure that the availability is there. And I'm feeling very encouraged about that. As I mentioned earlier, that is something that we were pleased to hear the state gradually open up more and more availability and move up the date, albeit by 1 day, but they confirmed the availability of vaccines for out-of-state students for this week. We're feeling confident that that availability question will go away, but we need to make sure that both of those are addressed before we make that final decision. I expect we'll be making that over the summer, probably by the end of June. We've talked a lot about fall, and what we're aiming for right now is that we would return to our normal operations, or the new normal, somewhere around August 1st. And that's what we're targeting for, because we need to start planning and be ready for students to return to campus. We've got early arrivals, we've got medical students, we've got staff coming in for some of the pre-orientation programs like TREC, and then orientation. So we're planning for a return to normal by August 1st. We have a lot of policy decisions that we're going to need to make over the next month as the decisions come out of Montpelier, now the governor's office, on how that's going to play out on campus. But we expect to have clear guidance on that over the summer. I know people are looking for a quick answer on certain aspects of it, but I would really encourage you to give us some time. We've got to wait for some of the very specific guidance, and you're going to hear me say it again, get vaccinated. One of the key factors will be in the rate of vaccines, both in Vermont and on campus, will affect our decisions and what we're able to do there. But as Patty mentioned, we're planning for in-person instructions in the residence halls, in the dining halls, the Davis Center, all the things that we know and love about UVM that made it so special. So next slide, please. So before I turn it back over to Patty, we open it up for questions. I really want to express my heartfelt thanks to all of you. It has been a year like no other, but it's been a year where truly UVM has stepped up. We've shown, and our staff have done a remarkable job. I cannot tell you the day doesn't go by where I don't think of or hear about something that you have done that have contributed to the success of our UVM. And it's been that rally together that has made it successful. And I can't wait till we can all be together and celebrate and just cheer about what a great job we've done this past year beating this pandemic back. I'm going to turn it back to Patty.
Thanks so much, Gary, and to the entire team, Mary, Francis, Tessa, Gary. So lots of questions coming in, thank you. So there are a couple of questions related to telecommuting and coming back, but I think Gary identified that we're trying to get back to normal, quote unquote, by August 1st. And there is a question, so that's one of the questions. And another question was related to how about staff who don't feel comfortable being around at all in the fall, or can they continue to work from home a few days a week? I think this is all part of the telework policy that is trying to be worked through, but Mary, I don't know if there's anything else you'd like to add to give people some direction and guidance.
Sure. Thanks, Patty. I think that it's too early to tell. I think that we don't know how we're really going to feel by the time fall comes around, and so I would hesitate to make any kinds of set proclamations at this point in time. Just rest assured that we will be in conversations and we'll be making those kinds of decisions just as we have on a case-by-case basis.
Thanks so much, Mary. Sarah Mel sent a question forward. Sarah, I think this is for me. Did I hear correctly that there were no remote option for undergraduate students in the fall? What I said is that we won't have what we call at-home options where in the registrar's office you could identify that you as a first or second year student would not be coming to campus and would be staying at home. It doesn't mean, though, that there could be a student for medical reasons or other reasons that they feel that they really need to stay home, and we might either recommend that they take a leave for that semester, or if they have sufficient courses that can be online and it allows them to continue in their progression. So it will be an individual thing with their advisors. But yes, that is correct. We're not going to do an at home, which was the traditional piece, but it doesn't mean that there are no opportunities for online classes. I think we have an increase in the number of online classes that are available to students. We're trying to limit that, especially for first and second year students, because it seems like they're really asking for the on-campus experience. Okay, does UVM have any plans to require vaccines for students, faculty, or staff? If so, what do those plans look like? I think Gary gave us a hint that we have not made that decision yet. The university has not made. We're looking at the issues. One of our concerns is as long as it's still on UEA, which is emergency use administration, we're being very careful and thoughtful. We're just encouraging people strongly to get the vaccine unless you have medical reasons otherwise not to. Gary, is there anything else you wanted to add to that?
No, I would just say that one of the things I would hope, particularly with the faculty and staff, that as you're making that decision, that I would say I would expect you to, because I would hope that you'd want to do that, because it will contribute to a safer and healthier campus for all. And it allows us to get back to normal sooner if we have a higher rate of participation in the vaccinations.
And I think I want to reiterate that. I know there is some fear, and then you hear news about people having different reactions. We met with our infectious disease expert on campus here, who's also running some clinical trials, and she said the data that's coming out now is that symptoms for COVID are much worse than side effects for those who've gotten the COVID vaccine. So I know it's a personal choice for many of us, but it does, as Tessa said, gives you a lot more opportunities to have some access to things that you might not, and also supports the larger community. So Les is asking a question, and I think this is going to go to Francis. Do departments need to report a change in the safety officers and or logistics coordinators so you have a current list at all times? Can they report this change online themselves so the emails that go out to the correct person? How are new safety officers trained to know what their role is? Francis, I hope you're the right one to answer that.
Sure, and thank you, Lee. That's a good reminder that we'll send out a communication to the safety officers and supervisors, asking them to update that information, and then so then we'll have that list. I appreciate that reminder. And the training really goes back to we have a website with the roles and responsibilities, which we should probably reconsider. I think we developed that at the beginning of the fall semester, so we should probably look at that and see how that's changed. So I don't know if that really answers your questions, but all of that goes on my to-do list, so I appreciate it.
So thanks, Lee, for keeping us on the straight and narrow so that we follow up and answer your questions. All right, an important question. Gary, I think I'm going to share this with you, and I know you and Michelle have talked a little bit about this, but what are UVM's plans to support UVM student, faculty, staff who are COVID long haulers? Evidence currently shows that 10 to 30% of COVID infections results in long haul symptoms, which are debilitating and need support. I do know Erica in her office in the Vice Provost for Student Affairs is looking at how we provide mental health support and other pieces, but Gary, anything you want to add?
You know, that's an excellent question, and you know, as we've struggled with getting message, particularly to students, about being safe this spring and not taking those risks, and we're all tired. We're all tired of having to not be together with friends and families in the way we remembered it. But those are the situations where the spread can occur. I think people assume that, okay, I'll just get the mild symptoms and I won't get the long haul COVID or whatever the word you want to call it. But there are students that are experiencing long haul symptoms, and our health service is working directly with them and providing the support they would for any student who is experiencing any prolonged physical illness as well. As Patty mentioned, we've got additional support services for our students around mental health issues. But again, you know, the best way to stay safe and to get that vaccination so that we can reduce that spread of COVID. And you're right, long haulers serious. And I would say on the HR side, I think it would fall under any other benefits around sick leave.
Okay, thank you, Gary. This is probably for you as well. Of course, we probably don't have a decision on this. Will masks still be required on campus? I think a lot depends on what the state guidance is and what we feel makes sense from our public health experts. But Gary, anything you want to add?
Yep, so that's a good question. And if you look at the guidance from the state, that if all things goes as planned and we reach those various thresholds with regards to the vaccination rates, beginning July 4th, it becomes universal guidance, and one of them is that masks will be encouraged. Again, we've talked a couple times, and I keep coming back to that. There may be different requirements for higher education, but I think it's going to be very close. That decision is going to be very closely tied to the vaccination rates that we see with our faculty, staff, and students on campus. So I keep bringing that up, and I will keep bringing it up.
Thanks so much, Gary, for reinforcing that. So Ben, thank you for your question. What was the major factor that led to the decision to have our students tested all academic year, but not our faculty and staff? I think Gary and I have been the cheerleaders saying faculty and staff should get tested. For our students, it's a little easier to make that requirement so that we can make sure they have access, and since they may likely have a challenge in managing some of the restrictions by us testing them, we can identify any potential virus earlier. And they have shown us that they actually can be responsible young adults. I know a lot of, I go and get tested every week, and I just had my second vaccine shot. I'm still not 14 days in, but I will continue to get tested as we're in this period of time to really model it for our students. Gary, I don't know if there's anything else you wanted to add.
No, I think that's exactly all I would just say too, is that we will continue to offer testing all summer long. We're going to be scaling back the hours, but we'll be open Monday through Friday. Our students that are here over the summer will be required to test, but testing will continue to be available for all faculty and staff. And those of you that have been doing the testing, thank you so much. I'm glad you've taken advantage of that, and we're going to continue to make that available.
So just a reminder for everyone to look in the Q&A, because Mary, I reminded employees that they can use emergency paid sick leave to get vaccinated, and if they experience side effects, they can use that as well. So we want to support you in this effort. So will meetings be in digital or 6 feet apart in the fall? I think it will vary. We're trying to determine, what is the appropriate distance, and as we've talked to our public health officials, and as that is discussed at the CDC level and the Department of Health level, I think the one thing we want to remind ourselves is we don't want to be in crowded places. So wherever we can be socially distanced, whether that's 3 feet or 6 feet, or we just don't want to be on top of people, we are going to encourage digital meetings for larger meetings. One, it's efficient and effective. And we're trying to give as much space to educational space in case we have to do some physical distancing. Again, crowded places are a problem, so we want to manage that. And we anticipate COVID is going to be here for another couple of years. This is what I've heard. But if we have 65% to 70% people vaccinated, herd immunity takes over and it makes it a little easier. Gary, anything else you want to add?
The only thing I would add is that I think we've all become much more proficient at virtual meetings than we were before COVID started. I know for my division, we've done some really cool training sessions as a division. My directors, rather than having to come from all different parts of campus for meetings, we're able to meet and be more efficient with our time because we don't have to build in travel time for those meetings. So I would encourage us to think about how we can continue to use this platform to operate more efficiently and effectively.
Thanks, Gary. Another question, and I don't know if we have determined this yet, but once you're fully vaccinated and you're 2 weeks plus, should they still continue to complete the health check-in on a daily basis? I think we're saying yes until maybe, Tessa, maybe until August 1st or July, who knows? But Tessa, you have the word on this one.
Yep, thanks, Patty. So as of right now, vaccinated or not, it's still a requirement that we do the daily health screening. There's also some, very specific instructions in there that relate to symptoms, which, doesn't matter if you're vaccinated or not. You still need to follow the instructions that come up. So at least for the foreseeable future, it's required. There isn't a health check-in requirement under the universal guidance. So, perhaps when we move to that, if there isn't a special higher ed requirement, we might eliminate it. But as of right now, vaccinated or not, you're filling out the check-in form daily.
Thank you so much, Tessa. The next question is, given staff and faculty were not required to test all semester, how was the decision reached to require all faculty and staff supporting commencement to get tested? I will give you my opinion on this, and Gary can add. We will have a crowd of 300 students who have been testing on a regular basis. The faculty and staff who will be supporting their graduation are going to have direct contact with those students for an hour. We're only allowing 2 guests, and they have to be vaccinated. Otherwise, they can attend virtually. I think this is the least that we can do to support our students. And because we're going to have direct contact with them in terms of guiding them to their seats, being on stage, etc., that this, for me, was a no-brainer. But Gary?
Patty, I would agree 100% with what you said. I will tell you, and Patty and I both lost a lot of nights' sleep wondering whether we were going to pull off commencement or not. And we have been working with the state for weeks now to try to get approval on what we could do for commencement. And when we went and made the announcement in March, it was before the governor's Vermont Forward plan. And we didn't know whether we were going to be able to do it or not. But at that point, there were very, very clear guidance and restrictions about limits to outdoor size. We even pushed that plan because at that point it could only be 150, but you could have two groups of 150 if you divided them. And we were envisioning 150 on one side of a fence and 150 on another. We didn't think we were going to be able to get in and include guests. We thought it was going to only be students. So we proposed that everybody that's going to be on that field for commencement, if they're a student, faculty, or staff, they're going to have to be tested. And I want to thank those folks that have been working with Kelly and Heather on planning commencement and rethinking how we're going to do it. It's really exciting what we're putting together and what we're going to pull off on those 2 days. 10 commencement ceremonies in 2 days, moving people in and out. And I just want to thank everybody who's helping to make that possible.
Thanks, Gary. The next question is kind of a modification of some earlier questions. If masks are not mandated, depending on the outlook, will space requirements still be maintained? Again, I think it's what we've learned through COVID and the flu is washing your hands regularly, not being in crowded spaces, and not sneezing and coughing on people is really a good thing. And I'm watching my crew here, and Tessa is smiling, so I guess I said the right thing, right, Tessa? So it's hard to say what we're going to do, but those are the three things we have to remember. So you don't want to be right on top of people, especially as we're still working through this COVID that's going to be going on for a while, especially with all the variants. So again, the vaccines helps us in a number of ways. One is it decreases hospitalizations, it decreases deaths, and it decreases the severity of symptoms. And that's what we want, especially for those people who cannot, for medical reasons, have a vaccine or other specific reasons. So the best that we can do is really support just healthy hygiene. And we do know washing your hands actually is one of the best things that you can do. So if any of the panelists want to say any more, raise your hand, otherwise I'm going to go on. I think the next one goes to Mary Brodsky. There's some confusion about regular sick leave for vaccination, and they want to just make sure they understand this, Mary. So, oh, I see you already answered it. You do not have to exhaust your regular sick leave to use this, please. Okay, thank you, Mary. You're just ahead of the game. I didn't pull down the thing quick enough. All right, anything else you want to say about that, Mary?
No, I'm just really do want for people to use EPSL in order to go get vaccinated as needed. The point of the matter is that we want for you to get vaccinated, which was part of the reason that the university chose to extend EPSL through the end of September. You know, so it's there for your use. Thanks.
Yeah. Great. Next question, good one. Gary, I'd love to hear your perspective and maybe Francis. Will there be capacity limits in buildings still? The example is an interesting one. In normal times, for example, the Hall Library is packed with thousands of students, which feels a bit scary and daunting now. I imagine we will continue to manage some kind of limitations in crowds, but go ahead, Gary, and Francis, if you want to add anything.
Sure, thank you. I'll respond briefly and I'll let Francis. So this time last year, we were closed, and it was somewhat easier because we said we can't do anything. And we shifted and pivoted to all remote. We did that through the summer. We built plans to return to in-person operations for the fall on a very limited basis. Now what we're having to do is do the reverse. And we're having to look at what we want to be like when we return to in-person operations in August. We're going to have to look at all of our facilities. There may be facilities that we're going to have to look at and say, we just don't feel comfortable returning to that normal capacity with what we have right now. We may need to say in some settings, we're going to say, you got to wear a mask if you're going to go here, or we're just going to have different controls on there. And, you know, I keep calling it COVID time. Fall is about 4 months away, and we've got a lot of thinking to do. And I would say, keep bringing these issues up. We're going to have to work through them one at a time and develop individual and specific guidance for each of those. But Francis, anything you want to add?
Yeah, I would add this question, the mask question, the daily health check question, all have something similar in that we're right now still operating in a state of emergency from the governor. And what we're going to transition to is really a public health. The COVID is going to hopefully become another public health issue, like influenza, like rhinoviruses, like all kinds of other things. So I think these questions all have that similarity, that what's going to be required and what's going to be the culture might be two different things. So will they be required? Hopefully at some point, you know, we won't have masks and we won't have daily health checks, but what should become the culture is more of the public health, washing your hands, hand hygiene, staying home when you're sick, staying away from people, staying out of crowded places if you have any symptoms. So I think there's a little bit of that culture change and switch from an emergency to general public health.
Thank you, Francis. I think you actually made a really important point. I think COVID, as challenging as it has been, has taught us about some strategies that we can do to keep our families healthy and ourselves healthy. And I'm hoping that some of that will carry over so that we can still have connections with people, but we do that in a way that is safe. All right, so here's another question from the lab safety meetings on Mondays. All non-UVM people on campus need to be vaccinated, right? How can we reinforce that? I don't know who wants to take that question, if that's Francis or Gary.
Francis.
Go ahead, Francis.
Since that's my meeting, I'll take that. Something may have been misunderstood. So all non-UVM people, I think what we're talking about there is non-UVM students who might be on campus this summer. So when we talk about students on campus, we'll have undergraduates and graduate students associated with the university, and they will be required to test on some frequency. You know, right now it's twice a week, whatever it is during the summer, they'll be required to test. Non-UVM students who might be here in an REU grant or a SURF grant or some of the other opportunities for people who aren't part of the university community generally will be allowed on campus, but since we can't incorporate them easily into the testing protocol, the decision's been made that they would have to be vaccinated. So I think that's what we're talking about. So I hope that's clear.
Thank you so much, Francis. Mary, the next one hopefully is a simple answer. Do you need to complete a form to use EPSL?
You do not need to complete a form to use EPSL if you're using it intermittently. Ideally, you will be completing that form if you are going to be on a leave of absence, so that's more than 10 days. And what I would say is it's most important for you if you are using EPSL and you're obviously in communication with your supervisor and following leave procedures in accordance with your department in order to use that time, but to put it in the system. You want to be recording your time in PeopleSoft or in Kronos as applicable to you. Another question had come in separately to me that I'll just touch on, Patty, since I'm here, but it's pertaining to EPSL generally, and the idea that folks were not able to use it intermittently prior to April 1st, and I think that there seems to be some confusion, so let me dispel that for you. After April 1st, the university made a conscious decision to allow for the use of EPSL intermittently, specifically so that people could get vaccinated and then address any symptoms that they might have as a result of that, of getting vaccinated. But we also reset for everyone the balances. They're not balances in the system, the way that you look at accruals, but we made it available so that everyone has 80 hours or up to 80 hours, depending upon your status as a full-time or part-time employee. So again, if you have any questions that are specific for you as an employee about EPSL, please email uvmler@uvm.edu, and I will put it in the Q&A so that you can see the actual email address. We're happy to help you. You can also speak with your HR reps. They're super informed about this and have heard probably me and my team talk about EPSL more than they would care to. Thank you.
Thanks so much, Mary. Okay, this is a good question, Gary. How are food and drink options going to look on campus? And are we going to have reusable options versus single use? Any thoughts about that? I know you've been communicating with Sodexo and others.
Yeah, so I want to start by giving a shout out and just a huge thanks to our university dining partners in Sodexo. They've done a phenomenal job throughout this year delivering food service for our students on campus in so many new and different ways. They've done a great job and wonderful partners in that. As I've talked a couple times, higher ed has specific directions. Food industry as well, and catering services has very specific guidance as well too. That changes a little bit in May and a little bit more in June. What we'll have to do is take a look at what that will be once we hit July 1 and probably even later into August. We've had conversations about them continuing some of the options that they've had this year and making available to students that were popular. So I would say we learned a lot about what worked for students this year and dining services. We expect to expand and reopen many facilities that were closed this past year for use of food services.
Thank you, Gary. Another good question coming up, I think this one's for me, are options being explored to allow COVID positive students options to attend classes virtually for the fall. I think our job as faculty and staff are to try and make as many accommodations for students who require it. Fortunately, with our CARES Act dollars, we upgraded all the classrooms to have the capacity to record lectures and to allow students to join via Teams. So I think whatever we learn that work, if a student is positive, this is a great way for us to make sure that they do not get lost in their classes. For those who are not feeling well, there are other options, and that is recording the classes, which is very easy to do on Teams. But I've had students test positive in the class that I'm teaching, and they were at home. And they didn't have many symptoms, so they totally were able to participate. So we will work individually with students to make sure they're accommodated. I think, Mary, this one's for you. Will there be any accommodations made for employees who are sick with non-COVID illnesses, such as cold or flu, to encourage people to stay home when they aren't feeling well?
Sure. To me, accommodation is a formal accommodation under the Americans with Disabilities Act. And I'm not sure if the questioner was asking that particular question or if they were just thinking about should there be flexibility in with how they should not be coming into work if they're sick with the common cold or the flu. And so what I would say is you should absolutely be in touch with your supervisor, and that is what sick time is for. We do not want for you to come to work sick. Nobody should have to come to work sick. And similarly, if you're home and you're working from home, you do not need to drag yourself to the computer. If you're sick, that's what sick time is for. So please take care of yourself. And if you have situations right now where if you've exhausted your sick time balances, talk with your supervisor, involve labor and employee relations, and we'll do what we can to help you.
Thank you so much, Mary. Francis, I think the next one is for you. Can non-UVM undergrads work at UVM labs during the summer semester?
Yeah, that's going to be allowed, and that's where they would have to be vaccinated, and we'll have that. That will be part of the rollout. That I hope to have the details next week on how all undergrads are going to be allowed on campus, and the non-UVM would have to be vaccinated.
Yes, thank you, Francis. And a related question, currently we are not allowing visitors into our buildings. Do you see that changing this summer? Gary, I don't know if you want to, I know we have visitor and travel policy and that's ever evolving, but your thoughts on this one?
I think you framed it right. It's ever evolving. I do expect that at some point this summer, we will relax the visitor policy on campus. Again, it's going to be tied to the rate of vaccinations and the fact that we feel less risk of people who are not testing coming to campus that are not vaccinated. That's the primary reason we made that decision this year, is because we did not want people coming to campus that we did not know the state of, and we just needed to make sure it was safe. So I expect that that easily by August 1st, that will be relaxed.
Thank you. Okay, we're coming down to time, and make sure you check. Mary gave another contact to support you for those who are having questions about EPSL. So has the telecommuting policy been changed for non-exempt employees? So nothing has been changed yet. We're working on it, and I think more to come. Anything else, Mary, you want to say about that? And you'll have to unmute.
That would be helpful. I just want to remind everyone that we are all teleworking, regardless of our exempt status at this particular moment in time. And so that was something that, you know, you should just all be aware of. And so we are looking into formalizing that, as Patty indicated.
Okay, so this is our last question, and I don't know who wants to answer this, but when are facility rentals going to be allowed again? Some departments that rely on the rental revenue are really struggling. We are losing clients not having been able to rent 2 summers in a row. Which of my panelists would like to address that question? I think Gary raised his hand, so go ahead, Gary.
Thank you, Patty. And I understand that University Event Services reports to me that manages space on campus. I expect that shortly after the start of the academic year, sometime in September, we will begin allowing outside groups to come on campus and rent and use facilities. We've talked about that date for a couple reasons. I think we're going to have a lot to do with reopening in the fall. We've got to reset an entire campus. There's going to be things that are going to come up that we just need all hands on deck to make sure we resolve before we start layering in on top of that outside groups coming to campus. So I expect probably sometime mid-September.
Thanks, Gary. And I know Francis is typing furiously to answer the next question about do the research activity levels need to be updated in any way? And I know that Kirk Dombrowski, our VP for research, is looking at this all the time with his researchers. I just heard him talk about it yesterday in the faculty teams live. And they will continue to look at it and make adjustments as appropriate. So on that note, we have less than a minute. I want to thank my panelists for doing an incredible job answering the questions. Thank you for the strong attendance by our awesome staff and your excellent questions. Every time I attend one of these, I get more questions that remind Gary and I things that we need to make sure that we follow up on. I want to thank you for everything that you've done over the last 2 semesters, even in snow this week, but there is sunshine out there. If you're not on campus, the sun is shining and it's beautiful. Thank you all. Let's celebrate our students being able to have some sense of a graduation and hope for a UVM forward in the fall and a really good summer. Stay healthy and well. Remember, wash your hands, stay away from crowded places, and just do everything that you need to do to keep yourself safe. And Gary would yell at me if I didn't say get a vaccination if you can. All right, thank you everyone. Have a great weekend.